patients ask me all the time, what's your favorite procedure? You will only get one answer: facelift. I love facelift. It's my zen. It's by far my favorite procedure. I think it's very elegant. It makes a huge difference, and the patients are very happy with it. How is our facelift different than any other facelift you can get? New York City, it's swarming with plastic surgeons, great plastic surgeons, super talented plastic surgeons. You can't go wrong with many of them. I feel every patient has their own needs and drive, what kind of pushes them towards one plastic surgeon as opposed to other. There are 3 or 4 things that we do different that are very unique in my opinion, that makes our practice or our facelifts very different than other facelifts. The first part is awake facelift. So there are lots of patients who are very hesitant to go under anesthesia or have a tube in their mouth or even go to sleep for the procedure. Even though that's completely safe, their normal worry I hear all the time, doc, what if I never wake up from the surgery? I've seen more than 30,000-40,000 general anesthesia surgery. Guess how many times that has happened? 0. The chance of you getting struck by lightning is more than you not waking up from general anesthesia. So I understand that fear, but that's not the reason we try to avoid general anesthesia. We try to avoid it for more common things that we notice. With general anesthesia, your recovery is a little bit more bumpy. You will have more nausea, more swelling, more bruising. You do get lots of medications to keep you under anesthesia that stays in your system for quite a few days after the surgery. So you'll still feel kind of grumpy, different. Your recovery would be not as pleasant as opposed to if you don't get all those medications. So I do feel that's where the beauty of awake facelift comes in. So what exactly is awake facelift? You'll still be numb. So we will give you oral sedation. We give you medication such as Valium. It just calms you down, it sedates you. We also give you some narcotics to help with the pain. Once you're on the table, we have you lay down, we numb up the whole area. Once that's done, you don't feel a thing. You don't feel any pain, you will feel things happening to you. When I tighten the face and the neck, every patient tells me, doc, I feel some tightening. Yes, that's the surgery. That's what you paid the big bucks for. That's what the result is going to show. So that's where the result comes in. You will feel something is happening, but it's not painful. It does not hurt. And the beauty of doing awake facelift is your recovery is so much easier, so much better. You're not loaded with a whole bunch of medications that you'd get, which you typically have with general anesthesia. You don't have a tube in your mouth. You don't have a scratchy throat from it. The other option that we offer for patients who don't want awake facelift, we do what's called a twilight facelift. So it's like going for a colonoscopy. You will have an IV line, you will get medications from the IV line, but you still won't have a tube in your mouth. I'd say that's a little bit different than awake facelift in the sense that you are pretty sleepy and sedated and you'll have an anesthesiologist watching over you, but you still won't have a tube in your mouth. So we care a lot about, we think far ahead in terms of your recovery, and keeping that awake facelift part is very critical in my opinion. The other reason I like awake facelift is when you're awake, I can ask you to hyperextend your neck. I tell my patients, look up in the sky. The higher you go, the lower in the neck I can go. When you're sleeping, someone else has to lift that neck for you. So in my opinion, awake facelift is easier in my hands because I do so many of them. The second aspect, when people think awake facelift, and I have patients talk to me about this all the time as well, like, oh doc, I'm okay with a little bit lesser result, but I'm not going on anesthesia. That's absolutely wrong. That's biggest misperception or wrong perception with awake facelift. We do deep plane approach, which is the Ferrari, which is the gold standard for facelift. So what I tell my patients, the amount of work that I do in awake facelift, it's probably more than what 95 to 99% of surgeons would do under general anesthesia. So let's talk about that. There are different approaches of doing facelift. Facelift is not a skin surgery, it's a muscle surgery. The most important work is done not your skin layer. If I just pull your skin back, it's going to go back to square one in 6 months. So We raise your skin, then we go under the muscle layer. That's called the SMAS in your face, and it's called platysma in your neck. That's where the difference and the nuances of facelift comes in. There are lots of ways you can address that muscle. So there's something called plication, where you don't even raise the muscle, you just kind of bunch it together, give it a lift. Does that work? It works, absolutely it works. But in my hands, in our experience, it does not work as well as the technique that I'm about to describe. The second way you can do it's called smasectomy, which is what I trained to do, which is what I was doing earlier in my practice. Smasectomy involves you go under the muscle, you release it a little bit, and then you pull it up. I think the results are better as opposed to plication. Like if I just release the muscle over here, the ligaments holding it here, it's not released. So when I pull it, this is not getting pulled, or this is not really getting pulled. So the next natural progression, it's called deep plane approach, where I go under the muscle and I go all the way up. I'm releasing all the ligaments. It's technically challenging, yes. There is a learning curve, yes. And in my opinion, that's probably the reason most of the surgeons shy away from it. There are misconceptions that there's increased risk of facial nerve palsy or injury when you do it. There was a recent study, a big meta-analysis, comparing SMAS plication versus smasectomy versus deep plane facelift. And guess what? The nerve injury was least when you're using deep plane technique. You have to be in the right plane. I do only blunt dissection. My goal is to always stay in the right plane, and would touch, I've never had any nerve injury. And I think that's because as long as you're respectful of the planes, it works. So in a nutshell, very few surgeons do awake facelift. Very few surgeons do deep plane facelift. If you put that together, you can count on your fingers the number of the surgeons who do Ferrari level facelift, and while you're awake, you can literally walk out of the operating room and then your recovery is so much easier. Our wonderful patient is 1 month out from awake deep plane facelift and neck lift, and I cannot get over her results. I'll post her before and after, but love her shape, love her jaw. She is 66-year-old, guys, 66 years young. Tell me, how do you feel?
Oh Lord, this is so wonderful. At first, I must say that when I came before I did this, I was scared. But I met the most loveliest people. You and your staff, Dr. Singh, are phenomenal. You all make me feel so comfortable. You show me love. You show me care. You had patience with me. And when I came to do the surgery itself, I couldn't believe how calm and peaceful you make